Hi, this is Misty Wormsman with Maryville University doing my head-to-toe video for advanced health assessment. This is Brian, and he's agreed to help me today. Prior to entering the room, Brian emptied his bladder, and he opted to change into shorts rather than a gown. I obtained Brian's vital signs, including his height and his weight, and I also checked his vision, his distance vision, using the Snellen chart, and his near vision using the Rosenbaum chart. I'm going to go ahead and start my assessment with Brian's head and face. He's able to hold his head in an upright manner without any tics or tremors. His head is normal cephalic, well-rounded, without any obvious signs of trauma noted. Upon inspection of his external features, his eyes, his ears, they are symmetric and properly placed on his head. His skin pigment is consistent and pink. I'm going to ask Brian to do a few things so that I can assess his facial cranial nerve, which is cranial nerve number 7. Brian, can you wrinkle your forehead? Can you clench your eyes tight? Smile? Clench your teeth? Puff out your cheeks? Stick out your tongue? Okay, I'm also going to check trigeminal nerve, which is the cranial nerve number 5. I'm going to use this cotton tip applicator. One side is soft, one side is hard. I'm going to have you close your eyes. I'm going to touch your face, and you can tell me when I can feel it, whether it's hard or soft.
Soft, hard, soft, hard, hard, soft, hard, hard, soft, soft.
Next, I'm going to palpate Brian's scalp. I'm going to use a circular, gentle motion going from front to back. His scalp moves freely. Do you have any tenderness when I do that?
No.
I'm going to pay close attention to his hairline behind his ears and the crown, and I don't see any nits, any scrapes, any bumps, flaking of the skin, open areas, moles, anything like that. Next, I'm going to palpate Brian's facial bones. Do you have any tenderness?
No.
They all appear to be intact. And I'm also going to palpate his sinuses, his frontal and maxillary. Any tenderness?
No.
And they don't appear to be full or anything, so that's good. I'm also going to check Brian's temporomandibular joint. Open and close your mouth. Does that hurt?
No.
Like popping or clicking?
No.
Can you side to side with your jaw? Good. And I don't feel any popping or clicking either. So that's good. Next, I think what I'm going to do is go ahead and I go back up to the head. I forgot to mention Brian's hair. His hair is gray in color. It's coarse yet soft. He does have some bitemporal hair recession here, but he doesn't have any signs of alopecia. And when I pull on his hair, it doesn't come out easily. So that's good. Next, I'm going to get a little more in depth with the eyes. His eyebrows are coarse. They both extend out past the outer canthus. His eyelashes extend outward. There's no endo or ectotropion noted. When I pull down on the sclera, or pull down to check the sclera and the conjunctiva, it's pink. There's no redness, no drainage, or jaundice noted. I'm going to do a few tests on your eyes. I'm going to check his pupillary response with this light. So just look at me. And that's direct and consensual. Next, I'm going to do the cover-uncover test. I'm going to have Brian just look at my nose, cover up one of your eyes, and uncover your eye, and do the same with the other eye. Good. Okay, and when he does that, his eye that he had covered appears to focus without any problems with nystagmus or strabismus. I'm also going to check the 6 cardinal fields of gaze, which is checking the cranial nerves 3, 4, and 6. So I'm going to hold your chin in my hand, and then I'm going to have you just follow with your eyes the pendulum only. Good. I also need to assess Brian's lacrimal apparatus. I'm going to palpate that. There's no drainage or nodules or anything noted there, so that's good. Okay. I'm going to move down to the ears now. If I were to look at Brian's ears with the otoscope, normal findings would include a tympanic membrane that's intact and pearly gray membranes. And I would check those by pulling up and back on the auricles. His ears are symmetric. They are properly placed on his head. They are in line with the inner canthus up to the top of the ear. The auricles are pink in color. There are no lesions, moles, or open areas noted there. So that looks good. I do need to do a couple of tests on your ears. The first one is called the whisper test. I'm going to have you cover one of your ears, and then I'm going to whisper a series of letters, and I need you to repeat those back.
AJW.
Okay.
RMW.
Okay, and normal limits are when someone is able to repeat the letters back at least 50% of the time. Another hearing test I'm going to do is I'm going to strike the tuning fork. It's the Weber test. I'm going to place it on the top of your head, and you're going to tell me if you can hear the vibration equally on both sides.
Yes.
Okay, and then the next test I'm going to do is the Rene test. I'm going to strike the tuning fork. I'm going to place it on your mastoid bone. You're going to tell me when you stop hearing the sound. Then I'm going to put it in front of your ear, and then again you're going to tell me when you stop hearing the sound. Okay?
Now. Now.
Great. Okay. Do the other side as well.
Now. Now.
Great. Okay. Normal findings for this examination are that the air conduction is 2 times longer than the bone conduction. So there's a 2-to-1 ratio, and that's about what I found Brian's to be. So that's good. Next, we're going to go to Brian's nose. His nose is straight and symmetrical. I feel the bone, it feels intact. Any tenderness?
No.
Okay. I'm going to look in his nose with my light here. Okay. It's glistening pink. The turbinates are noted. They're in the same color. If they were to be pale, bluish in color, or boggy, that would indicate possibly some allergies. But I don't see that, so that's normal. I'm going to check the patency of his nares. So could you cover up your nares, please, and breathe? Does that feel equal?
Yes.
Okay, great. All right, so everything appears to be normal there. Moving down to the mouth, Brian's lips are symmetrical. They are intact, no fissures or cracks noted. Have you open your mouth and spread your tongue? His tongue is a dull red color. It is moist upon inspection. Looking at the mucosa, it's intact. No lesions noted. The top, your tongue to the top of your throat. The roof of his mouth, the floor of his mouth, there's no lesions noted there. The veins under the tongue, there's no varicosities noted. His teeth all appear to be intact. He does have some fillings noted. It looks like he grinds his teeth. He does have some wearing noted to his teeth. Look at the roof of your mouth. His hard and soft palates are both intact. And I'm going to look back in his oral pharynx area now, so I need you to say ah. It looks like Brian still has his tonsils. They are not enlarged. They are 2+ in size. There is no exudate, no redness, no foul odor noted. The anterior and posterior pillars are also noted. The last thing I need to do is check his gag reflex, which is checking cranial nerves in the 9 and 10. So I apologize that I didn't need to do that. Okay, sorry. So that is attacked, so that's normal. Okay. Moving down to the neck. Just looking at Brian's neck, his trachea and thyroid appear to be midline between the sternocleidomastoid muscles. His trapezius muscles are also symmetrical. There doesn't appear to be any jugular vein distension. There's no obvious goiters or enlarged areas noted to the thyroid. I'm going to now palpate your thyroid. I need you to swallow. When he swallows, the thyroid slides up, and that's normal. I don't feel any nodules or enlargement noted. Checking his carotid pulses. They are present bilaterally. I also need to palpate Brian's lymph nodes right now, so I'm going to start with the occipital, the post-auricular, pre-auricular, submandibular, tonsillar, submental, the anterior cervical, posterior cervical, deep cervical, supraclavicular, and infraclavicular. And there's no enlargement, so no lymphadenopathy noted, so that's normal. I need to now auscultate the carotids and the thyroid with the bell of my stethoscope. Take a deep breath and hold it, please. Great. So no worries are noted there. That's good. I need you to turn your head side to side, up and down. You shrug your shoulders. This is an assessment of cranial nerve number 11, which is the spinal cranial nerve. I'm going to have him do this now with some resistance. Good. Very good. All right, so that's good. Now I believe what we're going to do is move on to the upper extremities. I'm going to have you put your arms out in front of me. His arms are symmetrical in size, muscle mass. They are warm to touch. I don't see any modeling, any edema noted. His hands, his fingernails are well groomed. The nail plates are firm yet smooth, and the bases are firm. Their capillary refill is less than 3 seconds, and there's no clubbing noted to the nails. When I palpate the joints in the hand, do you have any tenderness there?
No. No.
Okay. Good. All right, how about on your wrists?
No.
Elbows?
No.
Shoulders?
No.
Good. Right. I also need to assess his radial pulses and brachial pulses. Very good. Okay, so now I'm going to have Brian turn around so I can assess his back. Turn a little more so very good. Okay, so looking at Brian's back, his respirations are even and unlabored. His color is pink. He does have scattered freckles noted. He has a large mole noted here, and a couple of other larger freckles noted. I'm going to now palpate for tactile primitus. Could you please say 99?
99. 99. 99. 99.
Very good. I don't feel any increased tactile primitus, which would indicate some accumulation of fluid or possible infection. When I palpate his spinal processes, they all appear intact. There's no curvature noted. Any tenderness noted when I do that?
No.
Okay. And when I percuss, any tenderness or spasms, anything like that? Okay. Okay. So next, what I'm going to do is I'm going to percuss his posterior chest, and I'm going to do that systematically going from side to side. A dull sound may indicate possibly a consolidation or pneumonia, something like that, and a resonant sound may indicate some possible air trapping. I'm also going to palpate the costovertebral angles. Any tenderness noted there?
No.
And I'm going to do a little percussion here. Those? Any tenderness noted there?
No.
So it doesn't appear to be any problems with kidneys like pyelonephritis or anything like that. I'm also going to, while I've got him in this position, I'm going to go ahead and percuss the laterals. So I'm going to do that also in a systematic fashion, going from side to side. Okay. And now I'm going to auscultate. Again, systematically going from side to side. Also, while I have him in this position, if I were going to assess his diaphragmatic excursion, what I would do is go in the mid-scapular area. I would start at the top and I would percuss down, and I would be hearing a resonant sound down to where I could hear a dull sound. When I get to that area, I would mark it with a marking pin. Before I would do that, I would have Ryan take a few deep breaths and hold it. So do that, please. Hold it, and then I would percuss down. Again, it would be resonant, 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 and then I would get to a dull area, and then I would mark it. Normally. And then I would have him take another few regular breaths, and then this time I want you to exhale and hold it. And then I would start at that line, and I would percuss up, and it would be dull, and I would go up till I hear resonance, and then I would mark it. And then the area in between is the diaphragmatic excursion. And that's 3 to 5 centimeters, and it is normal for that to be a little higher on the right, accounting for the liver. So I believe I am done on the posterior chest. So if you want to turn back around. Okay, so the anterior chest, again, I would do the same thing. I would assess for respirations even in unlabored. The skin is pink. He does have some freckles noted, a couple of moles there and there. Again, I'm going to assess for the tactile primitus on the front. 99.
99.
And I could use that, do that using the Palmer method, or I could use the other method. I also am going to palpate his cardiac areas. So I'm going to palpate the precordium, the left lateral, and the apex. And I'm checking for frills or heaves, and I do not note any frills or heaves. I'm also going to percuss the anterior chest. And again, it's going to be in a systematic fashion. And I'm also going to auscultate. Okay, and I'm also going to auscultate his cardiac sounds. So first we're going to do the aortic, which is on the left. Second, intercostal space. Pulmonic. Excuse me, it's on the right. Pulmonic is on the left. Herb's point, third intercostal space. The mitral. Tricuspid, sorry, the tricuspid. Then the mitral. So again, it's the aortic, pulmonic, Herb's point, tricuspid, and the mitral. And I'm listening for the S1, S2. I'm also assessing for any gallops, any rubs, any clicks, or any murmurs, which I did not note. Okay, I believe now we're ready to do the abdominal assessment. So if you could play that. Great. All right, just inspecting the abdomen. I do not see any scars, any abdominal distension, any bruising, any signs of trauma. His abdomen is flat. So that all looks good. The next thing you do on the abdomen is you auscultate. So I'm going to auscultate the vowel sounds in all four quadrants. And they are present. If I did not hear vowel sounds before I could document them as absent, I would have to listen continuously for 5 minutes. While I've got my stethoscope here, I'm going to go ahead and auscultate his aorta. The renal arteries. I'm going to switch over to the bell of my stethoscope. Aorta. The renal arteries. Iliac. And femoral. Great. Okay, and I did not note any brewing sounds. Next, with the abdomen, you would just do a general percussion of the abdomen just to get a sense of what it's like. When you percuss and you get a dull sound, you're usually over an organ. If you get a resonant sound or a tympanic sound, there's probably some air. So now I think what I'll do is just do now a light palpation. Any pain?
No.
Issues noted there. If I want to percuss for the liver, I would start at the top here, and it would be at the midclavicular line, and I would percuss down, getting resonant, And then once I hit dullness, I would be at the top liver edge, the border of the liver, and then I would start at the bottom. I would do the same, resonant, and then when you get to dullness, you're at the bottom liver border. If I wanted to palpate the liver, take a deep breath in. Attempt to feel the bottom liver border. Sometimes if you want to try another method, you could use the book method. Take a deep breath in. The book method, and book underneath the ribcage here to assess that. As far as the spleen goes, you go to the mid-axillary line, go a little further out. The same thing. You would percuss down. Hear a resonant sound, and you get to a dull sound. You also can have the patient take a deep breath in to palpate. The liver, or the spleen is a little harder to palpate. Usually you don't palpate that unless it is enlarged, so that's okay, but I'm not feeling that. Also, I can feel back here for the kidneys. Okay. So everything appears to be normal there. I think I'm going to have you sit up now, and I'm going to assess your lower extremities. So go a little higher so you can see. Okay. So the lower extremities are symmetrical in size and muscle mass. They are warm to touch. There is no modeling noted, no edema noted. The hair distribution is equal. He does have some hair loss noted to the bilateral shin areas, and that is equal on both legs. I'm going to check his pulses now. His pedal pulse and post-tibial. And pedal and post-tibial. And they are both present and equal. And if I wanted to attempt to assess the popliteals, I would do that there. Okay. Assessing the joint, the knee joint. Any tenderness?
No.
No crepitus is noted. The tuberosities, they feel good. No crepitus noted there. Same with the popliteal spaces. Feel okay. Good. I need to check the deep tendon reflexes. I'm going to do that with my reflex hammer. I'm first going to do it on the upper extremities. The brachial radial, I'm going to have him lay his arm here in my arm, and then I'm going to strike the tendon. And you can see that was a good result there. Same here. Very good. Then you need to scooch out so those are dangling. There you go. Very good. Very good. And then I also need to check the Achilles. So look a little higher here, be careful, don't pull off. Okay. Checking the Achilles. Just kind of relax your foot, please. Very good. Relax. Very good. Okay, good. All right, so those are good. Now I'm going to lower the bed so that you don't fall, and check some musculoskeletal things. Could you get down off the bed, and could you just kind of walk a little bit? You can see that his gait, his gait is steady. Very good. Okay, so now I need you to face the camera and maybe do it this way. And could I have you lean forward, touch your toes? Very good. Come back up. Okay. Again, I'm going to look at his spine. It's straight, no curvature noted. Palpating the vertebral areas. That also feels good. No problems there. No tenderness, anything like that, Ryan?
No.
Okay. Could you put your hands on your hips, and could you twist side to side? And can you lean back and lean forward? Okay. No problems noted there. Side to side again. Good. Okay. And it looks like your musculoskeletal system is all intact. So I believe, let me see, that concludes my video. Thank you for watching.